Hi, I'm Dr. Charlie Liu, and today I'm going to be talking to you about SGLT2 medications. So if you suffer from diabetes or heart failure, then you might have been prescribed one of these medications recently. And this is just a video to tell you exactly what they do and what to watch out for and side effects. So these are a relatively new class of medication which we've been using more and more over the last 10 years or so, particularly for diabetes. And you may have been prescribed one of the several tablets. They all end in glyphosine, so this includes empagliflozin, canagliflozin, ertagliflozin and dapagliflozin. There may be a couple more as well. And these are an exciting new treatment for diabetes that we again have started to use over the last 10 years or so. They work by causing your kidneys to filter out more sugar, more glucose. So you're essentially peeing out a little bit of extra sugar, probably about 200 or 300 calories per day. So a fairly significant amount. And for this reason, we know that they actually help with weight loss. Unlike some of the older diabetes medications which used to cause weight gain, they actually cause your weight to come down on average about 2 to 3 kilos. But obviously that can be a bit more if you include diet and exercise programs on top of that. So they are really exciting for that reason, and in addition to that, we know that they help to reduce your blood pressure by a few points, and we also know that they manage to decrease your risk of developing heart disease and kidney disease. So both they're both a reduction in heart failure and also in heart attacks, and obviously reducing the amount of kidney failure and the need for dialysis. So they're really good drugs overall, and we're quite excited about them as doctors because they do outclass some of the older diabetes medications that we used to have to use. But with any drug, there are some safety features and side effects that we have to talk about. So there are three main ones that I'm going to talk about today. So the first one, the most common side effect that we see is an increase in fungal infections, particularly around the groin and the genitalia region. It's probably about twice as common in people who take the medication compared to people who don't. So we generally advise that people just step up the hygiene around that area, just wash a little bit more frequently than you usually would, make sure to dry off afterwards. And of course, antifungal creams and medications are quite easily available over the counter at your local pharmacy. The main thing to watch out for is if you develop a painful rash or a spot in the region of the groin, then that's something that you should tell your doctor about straight away, because there is a much rarer condition called Fournier's gangrene, which is essentially an infection in the area of the groin, and that's much more dangerous. That is very rare and probably happens in about 1 in 150,000 people who take SGLT2 medications, but it is something to watch out for. So that is swelling or pain in the region of the groin. And then the third side effect that you need to watch out for is something called DKA, which stands for diabetic ketoacidosis. So this is essentially when the body starts to produce chemicals called ketones in your bloodstream. If you've ever heard of a ketogenic diet, that's essentially what that diet is trying to do. But in the case of DKA, the rise of the ketones in the bloodstream can be quite dangerous. Now, the symptoms of DKA include nausea, vomiting, stomach pains, shortness of breath, feeling generally unwell and tired, and in the later stages you can get this odd smell. It's a sort of chemically smell like sort of pear drops, but I wouldn't depend on that to try and find out what DKA is. So if you notice any of those symptoms and you can't explain it from anything else, then do contact your doctor straight away. Like I said, it is a dangerous condition that can happen, although it's quite rare, and so you shouldn't wait to contact a doctor and seek medical advice. DKA is a bit more common if you are unwell or having an operation, and so you shouldn't take the medication if you're experiencing a fever, or if you're dehydrated, or if you're about to go in for surgery. Make sure that your surgeon knows that you're on this medication, and they will almost certainly tell you to stop it for a period of time. And then once you're feeling better, wait for about 24 hours and then start taking the medication again. So this medication comes under what we call sick day rules. There's another video that I'll post on sick day rules that you can follow the link to later. It's also a little bit more common if you fast or are on a low carbohydrate diet. I mentioned the ketogenic diet before, which is deliberately designed to increase the level of ketones in your bloodstream. It's not really safe if you're a diabetic who's taking this medication, so we do not recommend that you go on a fasting diet or a low carbohydrate diet while you're taking SGLT2 inhibitors. Hopefully, however, if you're on this medication, obviously you will be losing weight a little bit, because it does burn off, it does cause you to pee out about 200 or 300 more calories than usual. So hopefully that's been useful. That should be everything that you need to know about these medications. And thank you very much for watching. There's more information in the link below.